if there's any question, if even an adults often are not diagnosed, as a kid. And so if you have a question, I just had a patient come in, and he said, I don't know why I'm here. I'm old. He's not that old, but he's lived quite a bit of life. And he said, this seems silly, but I just want to see. And sure enough, he does have ADHD, has dealt with the symptoms his whole life, but wasn't diagnosed, had trouble in school. All the boxes were ticked, and he's now on Wellbutrin at a high dose. And he says, my life has changed. He said, I wish I would have come in sooner. I wish I wouldn't have been scared to tell people about my problems. I was embarrassed to share that with people. And he said, this has changed my life. And that is wonderful to see. And how would that be? Wouldn't you want to give your child that if they were dealing with something, to get them tested? Maybe they don't have it, but then just to rule that out is so huge for them and to give them success. And so along with getting QB test, once you get it for not only the diagnosis, if people are on medication and they might think it's not working, the QB test can also assess how the meds are working and where the symptom levels are, which is fascinating.
So it provides a baseline.
Yes.
Yeah.
And so you can see if there's been improvement. And it's FDA approved, which is so fantastic. It's newer. And so we're excited to try it. But after reading studies, and I've seen people that have done it, that my husband did it, and the results were, he was emotional, because just to see that on paper and know that he's not lazy, it's not because he isn't motivated. I mean, he has these difficult things that he deals with. So we're excited to have that tool.
So clinically, I think it's awesome to be able to refer my clients to Aspire Medical to say, let's see, you tell me you have ADHD. The questions I ask you lean to that, but let's see how that tracks, instead of the piece of paper from the online assessment that they've taken. It's much more concrete.